Good morning. As many Connecticut families know, a medical issue that comes out of the blue can impact more than just your health. It can send people into a spiral of debt that can be hard to recover from. This week, the governor announced a move to remove at least some of that burden from tens of thousands of state residents. $30 million will be wiped out.
Heavy debt can just be cement over shoes. This is all about making sure that health care is more broadly available and accessible and affordable. And we want to make sure that nobody is discouraged from getting the checkup they need, the preventive care they need.
Joining me to talk about all this is a woman you saw just over the governor's right shoulder there, Allison Sesso. She is president and CEO of the organization Undue Medical Debt. She has been working with the governor to make all this happen. Allison, thank you so much for joining us. I guess the first question is, how is this possible? What exactly is happening here?
Well, we are a national nonprofit that gets rid of medical debt across the country. We've been able to get rid of $15 billion of medical debt to date. It's not magic. It is the market. There is, unfortunately, a market for medical debt in which for-profit debt buyers buy debt for pennies on the dollar from hospitals and other healthcare providers. And we take advantage of that, but the market and the pricing, and so we're able to take $1 and turn it into $100 or more of medical debt relief. And actually, in this case, it was or more. And instead of collecting on that debt, we send out letters to people and let them know that we've gotten rid of that debt and that they no longer owe it.
So let's break down how this works for people who may not necessarily understand. So someone goes and gets a procedure at some medical facility. They're unable to pay the bill. The facility attempts to collect for some period of time. And if they can't, if the bill remains outstanding, one thing that they can do is they can sell it to a debt collector. The debt collector buys that for way less than face value. Like you said, pennies on the dollar. The debt collector then starts hounding the person trying to get paid, hoping anything they get is found money. So if you can get in between those two, you can just wipe it out, right? Is that how it works?
Exactly, because we're not trying to make any money back. The money that we get is either from government, like in this case, Governor Lamont has put forward the funding through the federal grant, ARPA funds, and we also use donated dollars. So we have a lot of donors that support this cause as well, because it's a very common problem for American families, unfortunately.
So the letters will start going out tomorrow, the 23rd, and people, is it going to be a surprise for people? Do they know that this is coming their way? How will I know if I'm affected other than just opening that mailbox and finding that letter?
Yeah, it's a surprise. It's like winning the lotto without buying a ticket. At the end of the day, people have their debts, and if we can access them and we're able to buy it, and you qualify, and it's everyone that's 400% of poverty or below, or a debt being 5% or more of your income, if you're in that file, your debt will be relieved, and you will be surprised to get that letter in the mail.
So let's talk about real numbers. I mean, we're talking about a family of four. It's about 120 grand household income. Does that seem like a good number for you?
That's
So
correct.
if people are trying to do that math and see if they might be in there. Now, what if someone's watching this morning and saying, well, Allison, I don't know if you bought my debt, but I'd like you to. Can they reach out to you and say, hey, go look for this particular file?
You cannot reach out to us. There is no application process, which I think is a positive thing, because oftentimes applications get in the way of people getting these kinds of benefits. What I can tell you is that there's a heck of a lot more debt relief on its way, so be patient. We have some time to do more. This is just the first announcement. It's actually a relatively small amount of the work we're planning on doing and contracted to do in Connecticut. There will be approximately $650 million of medical debt relief happening. In that press conference you showed earlier, there were several hospitals that were standing with the governor and myself that are ready to work with us and sell us their debt so that we can get rid of it and provide that relief for individuals. So we estimate that at least 250,000 residents will be benefiting from this program.
What do you hear from people who are on the receiving end of your assistance? I think, you know, anyone who's been in that position, I'm sure, can appreciate how big of a deal this is, whether you still owe that money or not. But for maybe someone who hasn't had that crisis in their life, what can this do, and why is it so important to get rid of this? Because, you know, it's already somebody who's had some kind of health crisis because that's why they accumulated that debt. But there can really be a domino effect. Is that what you see?
Absolutely. I think the biggest thing that people express is a sense of relief when they get one of these letters because they feel like the world is against them. And then someone reaches out and they didn't take any action and says, "Hey, we're this, nonprofit working with your government, and we were able to create this relief for you." And so I think that feels like a real sense of hope and optimism is sort of reborn in the individual. People often disbelieve the letters, and that's why I'm so glad you're covering this, so people know to believe it, that it's real. And they have disbelief, and then that quickly turns into sort of tears of relief and joy. People unfortunately avoid going back to the hospital or going back to the doctor when they either have had medical debt or just fear getting into medical debt. And so I think the real benefit beyond the financial implications is the mental anxiety relief that people feel as a result, and the willingness to go and get the health care that they deserve and need and shouldn't be fearful of getting in the first place.
You say people don't believe them when they open the mailbox and see it. Thinking back just in the couple minutes we've spent together here via Zoom, you said it's a lottery ticket. You won the lottery, you didn't buy a ticket, and I'm from the government and I'm here to help. So I can imagine why some people might get that letter. But, looking at what you've done, New Jersey, Arizona, Los Angeles, New York City, other places as well. So in doing all this good, and you talked about the billions of dollars that have been, relieved across the country, what's the message maybe to people who don't have the debt, who are the voters and who are the people who have to tell the governments to do this? Is there a message in what you've been able to accomplish so far?
Yeah, unfortunately, it's that a lot of people are hurting from the problem of medical debt, that people are not able to afford the cost of healthcare, and that we have unreasonable expectations as to what people can pay out of pocket. Medical debt hurts at least 100 million people. It's to the tune of at least $220 billion problem in the United States. It's a big problem. And frankly, I would love to do something else. I would love to have a different job and to be put out of business because we've solved this problem in a more fundamental way. This is a tug of war between the insurance companies and the healthcare providers that just needs to end and take the patient out of the middle. They can't be in the middle of this anymore. We have unreasonable expectations on individuals, and to us, that needs to stop. And I think people need to not feel the stigma that often comes along with medical debt. I think the more we talk about it, the more we do this work, the more policymakers will feel pressure to impact and put forward bigger solutions that are beyond just relief at the end of the line.
We only have about 30 seconds left, Allison, but I know you said the letters going out tomorrow are the first round of the work that you're doing. I know it may not all be locked in yet, but can you give us a hint? When can we expect? Months, weeks? When are we talking about?
Yeah, so I'm so excited these letters will come out right before the holidays for individuals, and probably some of them will land right after. And then really, we're already talking with many, many hospitals across the state. So I would say early in Q1 and definitely in Q2 of 2025, people can expect more letters.
All right, Allison Sesso, President and CEO of Undue Medical Debt. Thank you so much for being with us. I know a lot of people will be running to those mailboxes starting tomorrow. Thank you so much.
Thank you.
If you'd like to learn more about Allison's organization, you can head to unduemedicaldebt.org. You see it there. It's UNDUE, medicaldebt.org.